Now, there's one other area. We talked about methadone. I don't have the time to go into all. Research shows that people who leave treatment who are put on buprenorphine or methadone are less likely to die. So we concluded that we'll provide that as a wide-scale public health technique. In the United States, we hear frequently one complaint. It's hard to do that in rural areas. It's hard to get methadone to people in rural Iowa. But we've been much more effective in doing that in cities. The areas where MAT is most readily available have shown the greatest surge in drug deaths. Large US cities see big junk in deadly opioid overdoses. Darn it. Once again, we have the perfect policy, and these people are dying on us. Why don't I define addiction while I'm at it? Would that be useful, do you think? Because I asked you. You become involved in something that diminishes your awareness of surroundings and feelings. It's immediate and predictable and encompassing sensations. Now, drugs are useful for addiction because if you inject heroin, you're pretty sure what you're going to feel like. They offer a full sense of control and personal value, but they reduce your healthy options, impairing the person. They worsen your negative feelings about yourself. They cause distress. So it's a cycle. And there's nothing special about the opioid molecule that makes people addicted. It's the fact that opioids are an effective mood modifier, especially when snorted or injected, that makes them satisfactory. This is the part where I make a plea for me to win the Nobel Prize.
You skipped an extra slide there, Stanton. You need to go back one. Or was it forward one?
I know where I am. I only seem at loose ends. I wrote a book in 1975 called Love and Addiction, in which I said that addiction is not a result of drugs. It's a result of a kind of a powerful involvement people create. The two ruling diagnostic documents in the world are the DSM, American Psychiatric Manual, and ICD-11, which is the International Classification of Diseases by the World Health Organization. Neither of them calls any drug addictive. But the word addiction does appear. DSM-5 is called substance use disorders and behavioral addictions. And ICD-11 identifies sex and games as addictive. What they're slowly coming to realize is drugs do not cause addiction. People become addicted to experiences that accomplish certain things for them with detrimental effects that they become wedded to. That's what addiction is.